As we work our way up the kinetic chain, we're going to talk about the shoulder complex, starting out with the latissimus dorsi, how it wraps from the lumbopelvic hip complex, the sacrum, the crest of the ilium, up into the inferior angle of the scapula and then over to humerus. That's a big place for us to start. That can cause dysfunction in the lumbopelvic hip complex as well as the shoulder complex, and many times is overactive and tight for weak core stabilizers because it's trying to pull onto that thoracolumbar fascia to create stability. Using multiple size rollers for this one can be a good job. I'll use a good old-fashioned high density foam roll for this one on the ground. Nothing too new, nothing too fancy on this deal. As you do start out, I would start just below the inferior angle of the scapula. Do think of that cylindrical approach where you can come anterior onto the serratus anterior. Now the serratus anterior is aggravated and eccentrically overworked in most people, so you will have some discomfort. Think of kind of scrubbing the ribs. You know, if you ever wrestling with your brothers or your friends, you make knuckles and you scrub right there, that hurts because the serratus anterior is aggravated. So you can go ahead and don't do that to your brother because I'll get in trouble. But if you go ahead and you bring the roller right over the serratus anterior, you can get a nice relief, get some fresh blood in there, flush out some of the toxins. And then as you get a little bit more on the lateral aspect of the scapula, you can get into the teres major as well as the belly of latissimus dorsi. Now don't go over the 12th floating rib, but you can come down pretty low to get into the belly of the lat, especially the fibers that run horizontally. Think of your body as that cylinder. Continue to work your way up towards the axillary armpit. The posterior rotator cuff is going to be screaming in most people, just eccentrically loaded, especially the infraspinatus that is beat up in almost everybody. So having this oblique angle or almost being chest up towards the ceiling can help us get into the posterior cuff. And you might even want to change the position of your arm forward like this to roll through and then release that aspect of the cuff.